So on the request by one of the student, I decided to jump to male genital system, which I have left it earlier. And here I am going to include only the male genital system. I'm separately going to take the female genital system. And so let's begin with the the male genital system. Here, pay attention. The code range, that is 54,000 to 55,899. And if you see the codes, how they are divided, that is also important consideration. I always tell, prior to starting the chapter, one must pay attention how is the how the chapter is divided, so that it is easy for you to navigate the chapter. Now, if you see the male reproductive system, it is divided into the external genital organ and internal genital organ. I have decided to include some slides of anatomy that will help you to strengthen your anatomy section also. Now, the external genital organ, it has testes. These are two in numbers, which produces sperms and testosterone, and they are situated in a sac-like structure, which is called as the scrotum, and it regulates their temperature. And then the penis, which is the primary organ for the reproduction, and the penis also includes the urethra, so it helps to throw the urine out of the body. Now let us move to the internal genital organ. In that, the first is epididymis. It is a tightly coiled tube. So if you can see here, it is a tightly coiled tube where the sperms matures and are stored. And then what are the other accessory organ of the internal male genital is vas deferens, which is a muscular tube, if you see like this, and that transports from epididymis to ejaculatory duct. Here it is a ejaculatory duct. Then ejaculatory duct formed by the union of the vas deferens and the seminal vesicle. So if you see here, there is a seminal vesicle. There are two in number, and they, along with the vas deferens, form the ejaculatory duct. The seminal vesicles are nothing but the sac-like gland that produces a sugar-rich fluid that provides energy to the sperm. While the prostate gland, these are very important, walnut-sized gland that secretes the fluid that helps nourishes the sperm and forms the part of the semen. And then we have the bulbourethral gland, which are nothing but the small glands that secrete and lubricating fluid. And then the urethra, so this part is called as the urethra. It is a tube that carries the urine and the serum out of the body. So the same tube, it carries the urine, and at this junction you will see that the ejaculatory duct, it joins the urethra, and that's why the same tube will also carry the sperms and the semen. Now let us understand certain important malformation related to the male genital. One is cryptorchidism. Cryptorchidism is nothing but the testes which fail to descend into the scrotum. Testes developed in the abdominal cavity and they descend down into the scrotum before birth. This is a normal path, but many a time they remain inside the abdominal cavity, and many a time we have to get the testes down, and then we have to fix it to the broad bottom of the scrotum, and that particular thing is called as the orchipexy. Then what is phimosis? It is nothing but the narrowing of the opening of the foreskin over the glans penis. Phimosis means to muzzle. Then BPH, BPH stands for benign prostatic hyperplasia. It is a common occurrence in the men over 60 years. Symptoms are urinary obstruction and inability to empty the bladder completely. And then epispadias and hypospadias. Epispadias is nothing but a congenital opening of the male urethra on the upper surface of the penis, while the hypospadias are the congenital opening of the male urethra on the under surface of the penis. So these are certain common malformation or certain abnormalities related to the male genital system. Now let us learn about the circumcision. Circumcision is basically taking out the foreskin from the glands, and we carry out the circumcision by two different ways. One is by putting the clamp or ring around the penis and devascularize the skin and just taking out with the help of scalpel. While the other is where we use the surgical excision, where it's a proper surgical way where we cut the skin. And for both these procedures, sometimes we give the block. Now when we give the block, sometimes we give the ring block, that is anesthetizing the complete area, or sometimes we give the dorsal nerve block where we anesthetize the main nerve which is supplying to the penis. So these are the some understanding about the circumcision, because it will help you to zero down the code faster. So the foreskin, which is also called prepuce, is a movable sheath of the skin that covers the head of the penis, and it can be retracted or pulled back. Circumcision is the removal of the foreskin. Now, when we carry when the circumcision is carried out, either it is carried out with the help of the clamp or with the help of surgical excision. So, if you see all the codes differ. How did you carry out that circumcision? Is it with the help of clamp or the surgical excision? Then regional block is always included. Sometimes we do not give the regional block, so that time we have to use the modifier 52. Again, the modifier 63, we don't use it on this code because we have a separate code for the neonates and we have a separate code for the 28 days older person. So since we have a separate code, there is no need to mention the modifier 63. If it is a repair or incomplete circumcision, we have a separate code. And frenulotomy of the penis, we have a separate code. So these are the code for the circumcision. Next, we move to the testes. Now, on the testes, we usually carry out orchiectomy, that is removal of the testes. And testes are two in number, so either we carry it out on the single side or on both the side. Sometimes we use the word partial, sometimes we use the word radical. Radical orchiectomy is usually whenever you are not only taking the testes but the surrounding tissue also, and there the approach is important. Now remember, whenever the structures are present bilaterally, one must pay attention to the parenthetical notes or the language of the code, because if the language of the code does not use the word unilateral or bilateral, then we may have to use the modifier 50. Then the archaeoctomy procedure can be carried out with the help of laparoscopy. So if it is a procedure is carried out with the help of laparoscopy, we have a separate code for that. And always remember, the surgical laparoscopy includes the diagnostic laparoscopy. And so this is all about test. Now let us take some question that will strengthen your guideline. Newborn male is scheduled for circumcision. He is sterile, prepped and draped, and a penile nerve block is performed. A circumcision is performed by the ring device. Hemostasis is achieved. Vaseline gauze dressing applied. Patient tolerated the procedure well. Identify the correct code for this procedure. So what is happening here? Let us collect our data from the encounter. He is a newborn male, and how did they carry out circumcision? With the help of ring device, which is similar to clamp, and they have given the nerve block. So we have enough data. Now let us zero down the code. So we have the code 160, that is for the circumcision surgical excision. But in our case, we have used the ring device, which is equivalent to the clamp. At some places they call it as a clamp, at some hospital they call it as a ring device. So 54150 is the circumcision using clamp. So we will definitely require a code 54150. So option A and option C is for the older than 28 days of age. What is our thing? Is a newborn male. So definitely 161. So option A and C goes away. In between B and D, we must find out our answer. So yes, B is the right answer, and we cannot take D as an answer because if you read the language of the 54150, it includes the regional dorsal penile or a ring block. Okay, so since it includes, there is no need to separately mention the block because this is only for the peripheral nerve or the branches anesthetization, and we don't have to code that separately, and that's why B is the correct answer. Next question. A 4-week-old infant born with undescended testes and phimosis arrives at the pediatric urologist office for the circumcision. The physician uses clamp without regional block. Now, though the case is phimosis, today he came for the circumcision and we have been told to code for the circumcision. So what is it? He is 4 weeks old, circumcision is carried out, and how did they carry out? With the help of clamp and without regional block. So I told you, whenever you are coding for the circumcision, these are the three important things: age, how did they carry out, and whether the anesthesia is included in that procedure, whether the anesthesia is given or not. So we have enough data. So tell me the answer. So now it is not by the surgical excision. So if you see this, option A and D goes away. Now in between B and C, you tell me the answer, because A and D, it talks about a surgical excision. So we cannot take that, and we have used the clamp here. So yes, B is the correct answer, because if you see here, this is the circumcision using clamp or other device, but with regional dorsal penile block. In our patient, we haven't used the block. And there is a parenthetical note, report 54150 with modifier 52 when performed without a dorsal penile or ring block. So B is the correct answer. A newborn male had an elective circumcision before home discharge from the newborn nursery. The physician uses the ring block for the local anesthetic and foreskin is placed over the glans. A clamp is selected for the size of the glans and constructing circular ring is placed over the foreskin to compress and devascularize the foreskin. The devascularized foreskin is excised with the scalpel. The ring device is removed and the penis is dressed. Identify the correct code for this procedure. So let us do our drill. What is the age of the patient? Newborn. How did they carry out? By clamping. And whether have they used anesthesia? Yes. And what is it? Nerve block. So there is no differentiation between the ring block and the nerve block. Because both are the type of the anesthesia that we use. So now tell me the answer. So yes, 54150 is the answer, because it talks about the clamp, it talks about the circumcision, it includes the block. So that's the answer. Now let's take the next question. A 20-day-old baby boy is in the OR for the repeat circumcision due to redundant foreskin that caused circumferential scarring from the original circumcision. Anesthetic was injected and the incision was made at the base of the foreskin. Foreskin was pulled back and excess foreskin was taken off, and the two raw skin surfaces were sutured together to create a circumferential anastomosis. Identify the appropriate surgery code for this procedure. Now this question is very tricky question, so pay attention. What they are doing? They are doing the repeat circumcision. So what could be the code? So you see all the codes and tell me the correct answer. So in this case, what has happened is there is a repeat circumcision has happened because of the redundant foreskin, which causes the circumferential scarring from the original circumcision. So we will go with the code 54160, and it is for the surgical excision, because what has happened is foreskin was pulled back and excess foreskin was taken off and the two raw skin surfaces were sutured together to create a circumferential anastomosis. So in short, surgical excision kind of a circumcision happened in this patient? Now this is a tricky question because many a time we feel it is a repair. It is not a repair, it is a second circumcision. Okay, and that's why we will go with the code 54160. Newborn baby boy underwent a procedure to slit the prepuce to relieve the constriction that prevent the retraction of the foreskin over the head of the penis. Next, a circumcision was carried out via surgical excision. A slit tissue was sutured at the divided skin to control bleeding. The patient tolerated the procedure well. How would Dr. David report? So we have the code and we will zero down the answer. So if you see the code 54000, below that there is a note, do not report modifier 63 in conjunction with 54000. That will help me to eliminate the option A. And except newborn, our baby is a newborn. So that will eliminate option B also. Now in between C and D. C is again C is not the correct code because it is except newborn. Uh, so we cannot take that, and zero we will find out whether our option D is the correct answer or not. Yes, option D is the correct answer because it is talking about circumcision, surgical excision. And here we have seen that they have carried out the circumcision and via surgical excision. So that's the correct answer. So we have learned about the hypospadia and epispadia. So hypospadia is nothing but a birth defect in males where the opening of the urethra is not located at the tip of the penis but rather on the underside, and it is relatively common condition. So you will see that the tip of the urethra is not here in the center but it is somewhere at the dorsal side. And chordae is nothing but a penile curvature. It is often associated with hypospadias. While not all the cases of the hypospadias involve chordae, it is common feature and addressing both the condition is crucial for proper penile reconstruction. So this is very, very important. And hypospadias is usually corrected or treated with the help of surgery to reconstruct the urethra and straighten the penis if needed. So let us look at the code of the hypospadias repair. We have the code range from 54300 to 336, and here whenever we are zero downing the code for the hypospadias repair, the important guideline is it is based on the meatus location, where the location is, whether it is distal, mid shaft or proximal, then whether have you planned this procedure in one stage or are you going to do it in 2-3 stages, because many a time it requires 2-3 stages operation, and whether the chordae correction or urethroplasty is included or not. These are the three important considerations. Then we have a separate code for the repair of the complication, and the component procedures, there are many procedures which are sometimes they are bundled and they are not separately reported, like the penile angulation correction, which is chordae. It is done by the Nesbit procedure, and so we shouldn't report that separately if performed as a part of hypospadias repair. So these are the important guidelines, one must pay attention to them while doing the question. So let us take one question. This 12 months old boy has a mid-shaft hypospadias with a very mild degree of chordae. He also has a persistent right hydrocele. The surgeon brought the boy to surgery to perform a right hydrocele repair and one-stage repair of hypospadias with a preputial flap. Identify the correct code for this procedure. So what they have done, they have repaired the mid-shaft hypospadias by one stage and very mild degree of chordae. So go through all these codes and tell me the answer. So if you see the code 54322, it is talk about one stage distal hypospadia repair with simple metal advancement, while 324 is with urethroplasty by local skin flap, example flip flap and prepucial flap. Prepucial flap you can already see here. Okay, and it is a one stage. So this is the indented code. So I'll be reading the above code till one stage distal hypospadias and with or without cordy or circumcision, and then I'm going to add this. So I will need a code 54324. So this two code goes away. Now check this 54324. How is the hydrocele? It is only on the right side. So we need to check. This is the excision of the hydrocele unilateral and this is the bilateral. And this is a repair of the tunica vaginalis hydrocele. Now in this case, did they do the excise? Did they do the excision or did they do the repair? So I can see very clearly that there is a right hydrocele repair that has happened. So I will require a code 55060. So I am going to use 54324 55060, and since these these are the two procedures done on the same organ, we will require a modifier 51. And of course they have given the ICD and CPT code. ICD code is Hypospadias unspecified, and then this denotes a congenital cordy because which was also mentioned, and this denotes unspecified hydrocele. So all these things are there, and that we will write the option C. The pediatric physician takes the newborn male to the nursery to perform the clamp circumcision. Identify the correct ICD and CPT code for this procedure. Now here we have the four options 54160 How did they carry out? By the clamp. What is the age of the patient? Newborn. So we have two things. So definitely 54160 goes away because it is a surgical way, and we have only two options B and D. So tell me the right answer. Yes, D is the right answer because 54150 it talks about uh, circumcision by the clamp method, and we have the ICD code Z41.2. It is an encounter for routine and ritual male circumcision. A newborn male 3 days old is scheduled for a circumcision before being discharged from the hospital. The procedure is performed using Gomco clamp. This method involves placing the clamp on the foreskin to minimize the bleeding, while the excess skin is excised. The circumcision is carried out without complication and the newborn tolerated the procedure well. Of the following answer, which best describe the encounter? What is our drill? What is the age of the patient? Newborn, 3 days old. What is the method they have used? Gomco clamp. Have they used the anesthesia? It is not written. And remember, it is the the unwritten rule in our coding that what is not written, we don't code it. So if they haven't mentioned anesthesia, we will not code it. Okay. So there is the anesthesia is not mentioned, so I can assume that anesthesia is not given. So take all those things into consideration and tell me the answer. So 54150 is the correct code because it is for the clamp and it includes anesthesia, but there is a parenthetical note which says that we have to use the modifier 52 when performed without dorsal or penile or ring block. And since the anesthesia is not mentioned, not written, not given. And that's why I will code 5415052. Now here is the code range 55700 to 55865. These are basically the surgical procedure on the prostate gland, specifically incision excision procedure, which includes the biopsies and the removal of the prostate, which is called as the prostatectomies, and other related surgical intervention. So here I have given the breakup. That is, the first few codes are for the biopsy. Whenever you are talking about whenever you are coding about the biopsy, pay attention whether what kind of biopsy is done, because for the fine needle we will go into the 10,000 series, and whether the radiological guidance is taken or no, that is an important consideration. Then 55801 and 865, these are the excision procedure of the prostate, which are including the different type of the prostatectomies, whether you are taking, whether it is a radical excision of the prostate, are we taking the lymph node or no, that also well described within the language of the code. And then we have the laparoscopic procedure also, and then other procedures on the prostate, they are also covered in the 870 to 899 code range, so pay attention to that. Almost nowadays most of the surgical procedure do have the laparoscopic procedure codes, because minimally invasive surgery is that everybody wants, where the the post-operative time reduces because the cuts are less. And that's why everywhere all through the chapter you will see that there are separate codes for the laparoscopy, so one must pay attention how the procedure is done. Now let us look at these three codes. These are the code which we use it for performing the procedure on the prostate, specifically in the context of the radiation therapy or other intervention to manage the prostate cancer. The first code is for the describe the injection of the spacer material. This spacer material, often in the form of hydrogel, which is placed in between the prostate and the rectum, and this is done to reduce the exposure of the rectum to the unnecessary radiation, because we are doing the prostate cancer treatment, so we need to protect the surrounding tissue, and for that we give this. Now 55875, this is the code used when the needle or the catheter are placed into the prostate for the purpose of the delivering the radioactive material directly to the prostate. So if you can see this diagram, you will see that we have this needle, and through that we introduce the seed into the prostate gland, and those seeds carry the radioactive material. This is a form of brachytherapy, that is the minimally invasive therapy that we do. And 55876 is, this is the code used when the metallic marker or the other devices are placed into the prostate to help guide radiation therapy. Now what are these metallic marker? We put this metallic marker into the prostate because whenever the patient is moving, or sometimes this cancer keeps moving, so if we have the metallic marker inside that prostate gland, we will be able to check the location of the gland, whether the gland location has changed or the cancer, that tumor has changed, and for that we will require these markers. Basically it will guide us properly. So these are the three important code, and pay attention to the parenthetical note below that, because these are mainly for the catheter and the needle, and through which we put the seeds, but it doesn't talk about the radiation treatment. For the radiation treatment or the application, we will require the special code, and many a time in order to put the biodegradable material, or for the marker, we take the help of the image guidance. And what kind of image guidance we are taking, that is also written. If it's ultrasound guidance, we will use the code 76942, and if it is a fluoroscopy, we will use the code 7702002. So pay attention what kind of guidance is done, and even the seeds application, depending upon the number of the seeds, this code varies. So these codes talks about that. So pay attention to that. Here I have given the picture so that you will understand how this brachytherapy or the radioactive seeds are put inside the prostate gland for the treatment of the prostate cancer. So now let us take one question. A 67-year-old gentleman with a localized prostate cancer will be receiving brachytherapy treatment. Following calculation of the planned transrectal ultrasound, guidance was provided for the percutaneous placement of the 1 to 125 seeds into the prostate tissue. What CPT is reported for a needle placement to insert the radioactive seed into the prostate? And we have this code. So let us see 55860 is the exposure of the prostate, any approach for the insertion of the radioactive substance. This is by the open method. 55920 is a placement of the needle or the catheter into pelvic organ and or genitalia, but except prostate. So we definitely cannot take 520, 920 and 860. In between 875 and 876. 875 is transperineal placement of the needle or a catheter into the prostate for the interstitial radio element application with or without cystoscopy, and this is placement of the interstitial device for the radiation therapy. What are we doing here? We are doing the for the needle placement. Okay, so that is an important word. So yes, C is the correct answer, because what is happening here is the placement of the needle that is happening, and we will go with the answer C. So let us take one more question. This gentleman has localized prostate cancer and has chosen to have complete transrectal ultrasonography performed for dosimetry purpose. Following calculation of the planned transrectal ultrasound guidance was provided for percutaneous placement of 1 to 125 seeds. Select the appropriate code for the procedure. So what they have done is they have done the ultrasound, then they have done the placement of the 1 to 125 seeds, and we have to code for the complete procedures. So we will code it accordingly. Now go through all these codes and tell me the answer. Remember, the question is we have to code for the complete procedure. So ultrasonography, placement of the seeds, everything, and even the treatment. So D is the correct answer, because if you see the 55860, it is the exposure of the prostate, any approach for insertion of the radioactive substance. So when we read the word exposure of the prostate, that means this is the open method. And if you see our question, it is said following the calculation of the plant's transrectal ultrasound, the percutaneous placement of the seeds happened. So it is not an open approach. So we cannot take the code 55860. That eliminates the option C and A. And remember, whenever we have the multiple codes, if one code is wrong, then that answer goes, answer is wrong. Now in between 558, in between B and D. If you see 55875, it is transperineal placement of the needle or the catheter into the prostate for the interstitial radio element application with or without therapy. So we will require this code, but it talks about only the needle and catheter placement. Now we have to talk about the seeds placement also, because that has also happened and we have to code for the procedure. So here they have given for the interstitial radio element application. So for the placement of the seed, we will have to go to this code. Now if you see this code in the radiology chapter, these codes are divided depending upon how many seeds, and if they are more than 10, we definitely take the 4 times 7 8 code. That is, this code we will require. And then this is for the ultrasonography which they have done it. So here also for the ultrasonographic guidance for the interstitial radio element application, so we will require, they have done the guidance, ultrasonographic guidance they have taken for the seed placement. So we will require all these three codes for the procedure. Now the next question is, a 48-year-old patient with a BPH has his prostate removed via laser enucleation. During this procedure, he also has a vasectomy. What code would report this procedure? Now I have taken this question, though it is not from this chapter, because it is related to the prostate. I have taken this. Now if you see the code, in this case 52648, it talks about laser vaporization of the prostate. 649, it talks about laser enucleation of the prostate, and 647, it talks about laser coagulation of the prostate. So we will require a code for the laser enucleation. So 52649 is the code, because this is the vaporization and this is the coagulation. There are various methods that we use it in order to remove the prostate, and we have used enucleation here. So we will require a code B and C. A and D goes away. So let us see what's our answer. So yes, B is the correct answer because 55250 it talks about the vasectomy, unilateral or bilateral. Now do we have to code that separately? So let us read the code 52649. It says laser enucleation of the prostate with a morcellation including the control of postoperative bleeding, complete vasectomy. So the vasectomy is included in this particular code, so there is no need to code that separately, and that's why we will zero down our code 52649. And this is my last slide from the male genital system. We stop here and then I will take the female genital system next time.